Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we are announcing 4 additional deaths due to COVID-19, all from the Winnipeg Health Region. I'd like to extend my condolences to their loved ones, their family, their friends, their caregivers. Our current 5-day COVID-19 test positivity rate is 4.8% provincially, 4% in Winnipeg, with 81 new cases identified as of 9:30 a.m. this morning. Total number of lab-confirmed cases in Manitoba is 30,588. I'd like to begin talking about our screening and sequencing work, looking for variants of concern. We know that viruses, such as the virus that causes COVID-19, change over time. And we expect to see many new variants. The vast majority of these new variants do not have any clinical concern, but we know some of them can lead to increased transmission or possibly even increased severity. These we refer to as variants of concern. Currently, there are 3 main variants of concern for the virus that causes COVID-19. B.1.1.7, which is first identified in the United Kingdom, B.1.351, first identified in South Africa, and P.1 first identified in Brazil. And so our diagnostic testing is what we use to determine if someone is positive with COVID-19. But additional work after a positive sample is required to identify variants and variants of concern. So it's really a 2-step process right now in Manitoba. This is including screening and then sequencing. So screening for variants of concern is done only if we have a positive diagnostic test. When the diagnostic testing is done at CADM Provincial Lab, Shared Health or Dynacare, the positive samples are all sent to CADM for this screening. And this screening can identify whether there's a particular mutation that's present in the variants of concerns. So once that test has arrived at CADM, there's additional time to get that screening completed. Our immediate goal is to have this done within 48 hours of receipt of the lab at CADM. And so after the screening, sequencing is far more complex. This maps out the entire genome, the genotyping or fingerprinting. So not all positive samples are going to be sent for sequencing. That's not required. Experts all agree that only a representative number of tests need to be sequenced. So certainly any tests that screen in will be sequenced, and then we take a selection of higher risk samples to be sequenced to be sent to the National Microbiology Lab, which include cases related to travel, cases where we're seeing increased transmission, outbreaks, etc. And so most jurisdictions like Manitoba aim to sequence about 5% of the screened samples. Some are looking to ramp that up over time. And so we know that with our sequencing that we've been involved with dating back to last March, we've identified many different variants, some variants that are even unique to Manitoba. We've only discovered the one variant of concern, which we announced last week. And so we have an excellent understanding of the changing trends in the virus from the beginning of the pandemic to now. We'll continue to have that good idea of how this virus is changing over time because of the network between provinces and the federal program. So to date, CADM has sequenced dozens of viral genomes from more than 140 COVID outbreaks in personal care homes, hospitals, jails, northern communities. In Manitoba, in partnership with the National Microbiology Lab and partners in other provinces, we continue to ramp up that screening and sequencing. This is an evidence-based approach to surveillance It means that our public health officials have been able to make informed, coordinated decisions on how to address COVID-19 in Manitoba. I certainly want to thank all of our staff at CADM Lab for their expertise, their tireless efforts throughout this pandemic, but in addition to their work on ramping up our ability to screen for these variants of concerns. There is a lot of interest in the detection of the first variant of concern in Manitoba that we announced last week. And again, we note that the sample must be received at CADM Provincial Lab before it can be processed. At the time that that sample was received, we had not yet begun our screening. So our process has changed even since then. We're now able to screen for those variants of concerns in a much timelier manner. Once that screen is complete, then it would be sent to the National Micro Lab for sequencing. So I can confirm that with all of our screening and sequencing to date, we have only discovered the one case of a variant of concern. We have limited contacts to that case, household contacts, and none of which have developed symptoms or tested positive at this point, and all of those contacts have been tested twice at this point. So it's really, all of this is again another piece of our entire repertoire on battling COVID-19. It's our public health measures that are in place. We have our very strict travel orders. We're requiring people who are entering Manitoba to self-isolate for 14 days. We suggest that they will be tested upon arrival, and again at 7 days. And this is what is really going to reduce the transmission of the variants of concern. So you can see in this case, with or without the detection of the variant of concern, this individual had to self-isolate the entire time that they were infectious. They self-isolated as appropriate, as we could see that there was no transmission even within the household, and contacts were identified and isolated as well. So really it's the public health measures combined with all the tools that we have that will limit the introduction and spread of the variants of concern in Manitoba. So we have been and will keep testing for variants of concern. We've done this from the very beginning of the pandemic. We knew that these RNA viruses will change over time, so we had been sequencing virus before variants of concern were popular terminology, and we'll continue to do this. And like I say, we have a very, very good understanding of the variants and their development over time. We don't have any further contacts from this individual case, and like I mentioned, none of those contacts have become cases. So we'll continue to sequence as per the national protocols, and we'll continue to make further improvements and adjustments as we continue this important work of these variants of concern. So we know our numbers have been trending in a good direction. We've seen decreased demand in our healthcare system over time, and that had set us up for further loosening of the restrictions, which are now in effect. But these cannot be taken as an indication to let up now, to take our foot off the gas. I've said a few times now, we've been here before. We don't have to look very far in the past to where we've been. And if we go back to the way we were interacting in October, there's no reason to believe we won't be back in November and December numbers. There's nothing that's changed in between that time. Other than now we have the increased risk of variants of concern. So if we go back to what we were doing in October, there's no reason to think we won't see November and December, and we'll be forced to go backwards. So we really want to take this very cautious approach moving forward at the same time as we're getting vaccines. This is a very important time for us to ensure we don't go in the wrong direction, keep our progress going. And that's going to deal with the fundamentals. So as we move forward and slowly reopening, we need people to stay home when they're sick, even just mildly ill. Stay home, get tested, but isolate. Everyone in your family should be isolating if someone's waiting for a result. This is our way forward. Like I've mentioned, we've had situations where very mildly ill people didn't think that it could be COVID because they had very mild symptoms and ended up being in contact with a great deal of people. We need to keep our minds to physical distancing, avoid crowded places, prolonged indoor contact, frequent hand washing. These are all these fundamentals that we've become accustomed to, and they are going to be more and more important as we loosen our restrictions. Just a couple of things to mention about the long weekend with the Louis Riel Day holiday on Monday. Some COVID-19 testing locations across the province have reduced hours, so please check the hours of operation prior to attending for tests. Because of the holiday, there will be no bulletin or media briefing on Monday, February 15th. Both will resume on Tuesday, February 16th. So thank you to everyone, and happy to answer some questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and two follow-up questions. Up first this afternoon from the Canadian Press, Steve.
Dr. Roussin, Dr. Tam in Ottawa and federal officials are warning about, a looming third wave based on what they're seeing in some provinces, not Manitoba, but 3 other provinces are seeing community transmission of some of the variants of concern. What is your modeling telling you about what might happen in Manitoba with the arrival of these variants?
Yeah, and so with the variants of concern, we know that there's strong evidence to support that they're much more infectious than the COVID-19 that we're seeing currently. And so if that took a foothold, if that became the dominant strain anywhere, then we're going to just see increased transmission, increased number of cases, and all of the sequelae to that. So increased hospitalization, increased ICU admission, and increased deaths related to COVID-19. So again, it's very important that we have these strict processes in place to try to reduce the introduction of the variant. We now have the ability to detect the variant early on. And all of our public health measures are geared towards decreasing community transmission of any variant. And so we are at, again, a critical juncture because we're loosening our restrictions. I think our numbers support that. We know that we have to take that least restrictive approach. But we're at that critical point that if we lose track of the fundamentals like we did in October, 1 month from now, we could be seeing November and December numbers. And if you add the variant into that, the numbers could look even worse.
And what is your modeling telling you in terms of a ballpark number, assuming there's high adherence to the restrictions as they're now laid out?
Right, so if we have our restrictions and combined with the public health measures, we're going to see a continued very slow downward trend of our case counts. If the introduction of the variant of concern, then we'll see a reversal of that. We'll see an uptrend in that. The timing is quite difficult to model because it has so many variables for when the variant would be introduced, how long it would take to get to community-based transmission. But if we stuck to the fundamentals, we can continue to see a slow downward trend of our numbers. If the variant is introduced and took a foothold, if we loosen up, if we go back on the public health measures and the adherence to those public health measures, we're going to start seeing those trends up, similar to what we saw in October and November.
And finally, we're hearing. Sorry, Paul. I get third, right? we're hearing that the lunchtime rush was not exactly a rush today as restaurants opened for the first time to in-person dining. What message do you have to people who want to go to a restaurant and they might be a little concerned about the potential hazard there?
Yeah, and so to Manitobans, to restaurant operators, is when we put these orders out, we feel that following these orders provides that level of safety against the transmission of the virus. So I'd say that if the protocols are followed, if the capacity limits are followed, if we have household members sitting only at the table together, then we're at a level where we can safely do these type of things, keeping in mind those fundamentals. So, I think all Manitobans have to do their, an own risk assessment within these protocols, knowing that our own risk isn't truly our own. When we fall outside of the protocols, when we take risks in excess of the recommendations, we're not only putting ourselves at risk, we're putting others at risk.
You are correct, Steve. Up next from CTV Winnipeg with 3, Michelle.
Hi, Dr. Roussin. Let's start with, what does reasonableness mean when ensuring household rules at restaurants is followed, so the household at the table?
Yeah, well, reasonableness is quite a common thing utilized in lots of situations. And so it's, it depends on the specific scenario. I would say that if we had, 4 individuals roughly of the same age sitting at the same table, and their IDs were not checked to see if they live at the same residence, I would say that wasn't probably a reasonable attempt to ensure it was the same household there. If we had, a family of 4 and we just ensured that the 2 adults were within the same residence, and for some reason it turned out that the, one or other of the youngsters were not in the same residence, I'd say that it was still probably a reasonable attempt to ensure that. So, I think that this is in the interest of everyone. It's not in the interest of any restaurant for our numbers to go up and we have to go backwards and shut down again. And so the sure way to do that is to ensure we don't have interactions outside of households for prolonged times indoors. And so it's in everyone's interest to ensure that those are household members at that table. If not, there's no reason to think we won't be back in November and we'll have to take a step backwards. So this is for, for everyone to do whatever they can to ensure we can keep moving forward.
I also wanted to ask about the first case of the variant and the investigation that's looking into the delay or that 18-day period. What is this investigation looking at? Is it a logistics thing? How long it spent in the freezer? Can you detail what they're looking for?
Well, we're going to look at any type of thing, right? So with these, with testing, just like any other process, there's a long continuum, right? There's a person presenting to the site. There's the documentation of the reason for testing. There's the sample collection. There's the sample transport. There's the testing. There's the reporting. There's the sending the sample to the reference lab. There's the processing and screening of it. So there's a lot of process. So just like any of our ongoing quality improvement that we do continually, we'll look at all those factors. I think the biggest issue is that that we now have an ability to be screening for the variants of concern, which sets our timeline up much earlier. And then again, I have to note that this individual was a return traveler, so with or without a test positive, they would have to have isolated at home. They did test positive, so with or without a screen or a sequencing for a variant of concern, they had to isolate for 10 days. And so that was done. It was done appropriately in this place, and we haven't seen secondary transmission of it.
Okay, thank you. Also, would there be any consideration if there were a lot of cases that we found of the variant, to bring in, experts in the scientific community from universities, or use some of their technology, some of their equipment if we needed it? Isn't that an easy way to scale up to partner with them?
Well, sequencing again is not a diagnostic test. Sequencing is surveillance, and so the Canadian COVID-19 Genomic Network has been up and running for quite some time, and it is at par with any place in the world with the sequencing it does, and its collaboration throughout the world. So we have that expertise, and that expertise has been utilized long before variants of concern were out on people's mind.
From City News, Mike.
Hey, good afternoon, Dr. Roussin. My first question is, do we anticipate seeing each and every variant of concern enter Manitoba? Is that just a reality that we should be preparing for?
We are preparing for that. I think that we have to be certainly prepared for that. We're going to be screening for that, and we have processes in place right now that should they present here, there's a limited chance that they begin community transmission because of our isolation guidelines and testing guidelines. And so just to be clear, with RNA viruses, we're going to see variants. We're going to see more variants of concern developed, not just these three, and that's why the collaboration between the provinces, federally with the network, as well as internationally, is so important to be able to detect new variants of concern. These definitely won't be the last variants of concern we see.
You kind of answered my second question a little bit there, but I'll ask it in a different way. Is it typical of an RNA virus to maybe mutate this frequently throughout a year?
Yes, yeah, RNA viruses are very susceptible to mutation for a number of reasons. Influenza is a great example. It's another RNA virus, and that's why we need annual flu shots because it drifts over time. So we do expect this, and that's why we were sequencing this from the very early stages of the pandemic.
And then my final question, this just has to be a bit of a theory. If say 15% test positivity is our threshold for starting to bring restrictions back, if these variants of concerns enter Manitoba, does that threshold become lower? Is that a reality we live with? Is if these are circulating, then maybe our threshold for restrictions has to be a little tighter?
It's a bit hypothetical. We always analyze the situation that we're in because we don't only base it on test positivity. We're going to base it on hospital demand and some other indicators that we discuss. What I could say with these variants of concern, the ones that increase risk of transmission, it's likely not necessarily to change our thresholds. We just can expect to hit those thresholds much earlier.
From the Winnipeg Free Press, Kevin.
Hi, Dr. Roussin, the Kevin at Free Press. One, I guess, clarification on the news release that it says there's been an outbreak declared at the Riverview Health Center. It doesn't say which ward, like the other hospitals. Do you happen to know which ward, or is it literally all of Riverview?
Yeah, I don't have a detail on that. I'll see if we could provide anything further on that.
Great. And as far as the Manitoba, you were saying how there has been some unique Manitoba virus variants. I'm assuming that's all been checked out in whatever way is done, that those are just become regular ones that are of no concern?
That's right, and that's why it's important to be connected. It's not just a matter of sequencing. The actual sequencing of the genome makes up a a small proportion of all that needs to be done when we're surveilling for variants. So we have detected variants that could possibly be Manitoba unique, and probably every jurisdiction will see things like that. But you're right, we have no indication to indicate that these are variants of concern, that they either increase transmissibility or that they have more severe outcomes.
Yep. And once again, with the household that had the traveler who does have the variant, the household also is being tested twice. Is that going to be standard for anybody with the variant, or is it standard with just anybody traveling that tests positive that household members are tested twice?
Right, yeah, so typically we test close contacts of cases, or suggest if they're asymptomatic, just a one time. For this variant of concern, we did want to test it twice. After we tested again after we received the notification that it was a variant of concern. So for the most part, for variants of concern, the isolation requirements of the case are much the same. Just because of the increased transmissibility, we're not going to accept people isolating at home and then declaring them successfully isolated. So if somebody with a variant of concern chooses to isolate at home with others, then everyone in that household, regardless of how well the person is isolating, will be considered a close contact.
From Global News, Malika.
Hi, Dr. Roussin. Thank you. I just wanted to know, I know the bulletin shows us about hospitalization numbers. Are we able to get a breakdown, or potentially looking into when some of the hospitals that aren't doing the elective surgeries right now may potentially get started again?
Mm-hmm. Yeah, I don't have that. I'm sure we can get that type of information. We are seeing a decrease in the demand of the acute care system due to COVID. Of course, not as quickly as we expected or certainly desired, because we see that there's a certain proportion of COVID-19 clients that will have longer durations of stay.
Okay, thank you. And just switching over, we'd heard that the Canadian military, Canadian Armed Forces were up in northern Manitoba at Pongassi First Nation, and we just wanted to see if there was any update on the situation there at all at this point.
Yeah, and so for the specific details about First Nations outbreaks or communities, we usually just direct people to the community themselves or the pandemic response coordinating team.
Okay, that's all for me. Thank you.
From the Brandon Sun, Colin.
Hi, Dr. Roussin. With the Western Hockey League trying to get its abbreviated season up and going, can you tell me if either of Manitoba's WHL teams have been cleared to resume operations at this point?
So it's we have reviewed a plan. I'm not aware of any definitive decision on on what actually the league will be doing. But the plan that involves a hub as well as regular testing has been approved. But the details of what will actually occur with our teams, I don't have.
Okay, thank you. My second question is about the recent daily case totals in Prairie Mountain Health. Since, I believe, the end of January, we've had cases either just above or below the 10 case threshold. Do you know what factors are leading to such low daily case counts in our region compared to the rest of the province?
Well, I think it's just, again, the trends that we see over time. We're going to see variability between provinces, between nations, and even between regions within a province. So there's going to be that variability. At one point, Prairie Mountain Health had much greater proportion of cases than other regions, and so we'll see that variability. We have to expect to see that. Again, we'd like to have a more targeted approach at some point moving forward, but we can see that there definitely are challenges with that. due to easy mobility between regions. So, as right now, overall, the province is trending in the correct direction, and we, want to have processes in place to ensure that it continues.
Thank you. My last question comes from a reader of ours. They operate an art studio in our region, and they were wondering why places like restaurants and gyms are allowed to reopen with limited capacity, but he is unable to yet to resume offering classes in her studio, even at a lower capacity.
Yeah, and I think this has been, really what we see at every stage of the orders, right? And so when we're trying to limit interactions, right, and that's how this virus is spread with interactions. We saw where we were in October, which led us to November and December numbers, and we just can't go back there, which means we just can't open everything at once. And so I think just at every stage, there's always very legitimate questions from business owners or from just people in the public on why this and why not that. We look at the sectors of a whole. We look at the risk base. We look at things like our feedback from Engage MB, and we have to make decisions. We just can't open everything at once. And that's really in everyone's interest. If we opened up everything right now to where we were in October, there's nothing that's changed with this virus. If we open up to where we were in November, there's no reason to think we won't see the November and December numbers again. So we have to be very cautious.
From the Winnipeg Sun, Scott.
Good afternoon, Dr. Roussin. I kind of want to go back to Steve's question off the top there about modeling, and I know you guys have been hesitant, I suppose, to release modeling for various reasons. We went through the second wave. We know how bad it can get. Perhaps these variants of concern, it could get worse. I imagine it would help if people see how bad it could get. And I know, sometimes you answer these questions in generalities of what could take place, how bad it could get. I'm just wondering, now that we've gone through it before without really getting a lot of modeling prior to the second wave, why not show people? It gives them something tangible to say, like, this is why you should hear or whatever. And I know you could say, well, you could adhere to phase two, the second wave could be the reason for that. But like, why not show people, I suppose, the modeling for this, even if it is kind of broad?
Yeah. I mean, I think that is something that we're looking at to try to have a bit more, regular updates with the modeling. I think that with we can show the sort of those four scenarios, right? All like coming from no public health restrictions to very minimal adherence to very heavy restrictions with excellent adherence with the in between. And so, right now we are up until these orders, and for in January we are trending in the second to best category. So we could see those numbers come down. Where we were in November was really the almost bordering that worst case scenario, and so we've made great inroads with these restrictions. Again, it's tough to know to model the exact effect of these type of loosening, and then it's very difficult to model the implication of introduction of the variant. Because there's so many variables when it's introduced, how quickly it gets a foothold as a community transmission. So I do think we're going to try to get a bit more modeling out there. What I can say is, the modeling, shouldn't come as a surprise to anyone. If we follow the restrictions, follow the fundamentals, we're going to see a continued downward trend. That's what's got us here. If we, fall back to what we were doing in October, we'll be back to November and December numbers. There's just no way around it, unfortunately.
Thanks for that. Just a question sort of on your messaging this time around, we are reopening again. What's going to change or has been changing in your messaging, to Manitobans, given the risk of this kind of returning back to October, November?
Well, I think that's the main point is that, at every step of whenever we put restrictions on or loosen restrictions, we'll hear concerns, of course, on both sides, whether that the restrictions should be even more restrictive, and from the other side that we should be loosening it for either specific sectors or anything. And the messaging is we just have to look at the numbers in November and December. So when we hear from people that the sectors are very safe and we can get back to everything we want to do because everyone knows what to do and how safe it is. November and December showed us that's not the case. As soon as we put these restrictions in, we started seeing the trend down, and now we put ourselves in this spot. So we really have to learn from where we were in November and December. That if we just go back to losing track of those fundamentals, we're going to see ourselves back in a position where we have to consider putting in more restrictions again.
Thanks for that. And my third question is a hockey one, but have you had any concern with the NHL's plan, given the issues that have happened down south? And have you looked at the new or the updated, guidelines that the NHL put out yesterday in regards of point of care rapid testing and those types of things? So I guess my question is there concern from you, and have you liked the response that you've seen from the NHL given what has happened down south?
Yeah, I think that in the North Division, things have been running quite well. The protocols in place are very stringent. When we're talking about daily testing, traveling by a private conveyance, working and living in essentially a modified bubble, very, very low risk to community transmission. As you can see in the U.S., that's certainly if you get a case within a team, then there's a risk to the players and to the league. But I think things have run quite well. They continue to adapt, and I think things have been quite successful to date in Canada.
Our final reporter this afternoon from CBC Manitoba, Bart.
Hi, Dr. Roussin. It's been a while since we've seen Southern Health at the top of the new active cases. According to the dashboard, it's the Altona Health District. What's going on in Altona Health District?
Yeah, and so they had a number of cases there from my reports here this morning. The majority of those cases reported today were household contacts. So we're already isolating and became cases. So we'll continue to follow that. But if we see that trend again, that's our public health measures that would hopefully stop that transmission chain right there.
Okay, I'm hearing anecdotal reports of officials in southern Manitoba being less willing to enforce or even simply be less enthusiastic about public health orders. I know that enforcement people do send memos, and you are briefed on this even though you're not responsible for it. What can you say about the cooperation of municipal officials regarding the enforcement of public health orders in the Southern Health District right now?
I don't have any specifics that I have on that. What I could say is that, overall, we've been at this for a long time, and people can refer to this as that COVID fatigue or however we want to refer to it. It's been challenging, but we all have to be aware that we're not out of this. Numbers have come down. If we just open up everything right now, if we think we can just look in the other direction, we're going to see those case numbers come up very quickly, and we're not going to have an alternative but to put the restrictions back on. So it's, you know, it's incumbent on all Manitobans, on leaders in Manitoba, business owners, to adhere by these restrictions, to adhere by the spirit, you know, of the orders. We have to decrease the amount of contact we have with people outside of our household, or we're going to see that transmission come up again.
Thanks for that. Changing the subject of sports, but not hockey. You know, you've stated repeatedly, other epidemiologists have stated repeatedly, large gatherings are the last things that are going to come back. How realistic is it there'll be fans in the stands at a Winnipeg Blue Bomber home game in less than 4 months?
Yeah, it's tough, Bart, for me to. I don't want to speculate on that. There's a lot of variables. You know, I think that you know, with this virus, we're expecting to see some seasonality, you know, with it as warmer weather comes about. There's a lot of things up in the air on just what our vaccine program will look at like at that time, because of the vaccine supply. So there's so many variables in play. You know, I would say that we're not back to normal. We're not going to be back to normal this summer or fall, and we'll just have to see exactly how this all plays out before I can answer a question like that.
It seems like a tall order.
Thanks, everyone. This concludes our media briefing.